Hi everyone, I am Dr. Suraj Chirania. I am a hematologist and BMT physician. Today we will discuss what is sickle cell disease. Sickle cell disease is a problem affecting red blood cells. As we know, red blood cells carries oxygen from heart and lung to distant organ of the body. In sickle cell disease, as a name mentioned, the red blood cell becomes sickled. Usually, the red blood cells are disc shaped, means half filled balloon. The character of this shape is they can switch through the circulation because of this character and shape of red blood cells. But in sickle cell disease, they become sickled, means pointed, so they stuck in small capillaries or small vessels in distal part of circulation, causing severe pain and obstruction to the blood flow. So when your child diagnosed with sickle cell disease, so you need to consult a doctor called as hematologist. Hematologist is a doctor which specializes in treating sickle cell disease. You need to discuss what to do and what not to do and what complication you expect in your child with sickle cell disease. Usually, if we see what are the symptoms of sickle cell disease, main worrisome symptoms for which you require some emergency treatments are fever, acute chest pain causing breathlessness. Third is severe excruciating pain in fingers and toes, swollen knees and hip joints. Fourth, when you have a prolonged erection that lasts for more than 4 hours, and if you have any weakness, severe headache, vomiting or giddiness or some blurring of vision, you need to visit your doctor on emergency basis. In sickle cell disease, why fever happens? Because sickle cell disease mostly affect the immune system, so patient's immune system become weak to fight the infection, so this infection happens repeatedly. Then this infection should not be treated with simple analgesics or antipyretics. You need to administer the antibiotics. So most of the patients we put till the age of 5 years on the medicine called as penicillin, which can be given twice a day orally. Second, there is drug called as hydroxyurea. The hydroxyurea causes some changes in red blood cell structure and increases the hemoglobin AF generation inside a body, that prevents deoxygenation of red blood cells, so that the good part of hemoglobin is hemoglobin F, that reduces the incidence of the sickle cell crisis in such patients. Second, we need to see what is acute chest syndrome. Sometimes these sickle cells get stuck in minor capillaries in the bone, especially of rib cage area or back area. When this sickle cell gets stuck there, they call severe pain, breathing difficulty, severe cough. So you need to visit emergency department on emergency basis, because it can constitute the acute chest syndrome. It may require hydration, blood transfusion and painkillers. That can be continuous analgesia can be required, and in very severe cases we need to do the exchange transfusion as well. Third thing, spleen is an organ that present in the left upper part of the belly. Sometimes these RBCs get trapped in the spleen, causes severe increase in the size of spleen. That is also a very problematic situation. Then you need to visit emergency department, because you might require the surgery for the same, or urgent attention by doing the exchange transfusion, hydration and other remedies to prevention of the complication. Fourth, when you have any penile erection lasting for more than 4 hours, you need to visit it on the emergency basis, because this sickle cell can stuck in the small vessels inside a penis, causes a painful erection. If it is not treated timely, then it can lead to a long-term problems related to the penis. Most important thing is a stroke can happen because this sickle cell can damage the small vessels inside the brain, causing a problem called as moya moya disease like thing, that it makes these end vessels very fragile and prone to bleed. So this can cause the hemiparesis, vomiting, sometimes loss of eyesight can also happen. So whenever you have a headache or weakness, you need to visit a doctor on emergency basis. So whenever you visit a hematologist, you need to make a periodic visit, and you can do a screening test just like transcranial Doppler on yearly or 2 yearly basis to know what are your chances of risk. And you need to visit a hematologist to see what type of vaccines you will require to prevent the infection. That's all for today's discussion. Till next, stay healthy, stay tuned, and stay informed.